Good morning, everyone. Greetings from Calabash, North Carolina. I am Kevin Doherty, and welcome to the annual election period. Some housekeeping items before we get started with today's webinar. This 30-minute live event is being recorded, and it'll be posted on my kmdinsurance.com website. If you are attending the live event, please note all attendees are in a listen-only mode. We will have time for questions and answers. If you have a question, please use your GoToWebinar control bar in order to type the question. You may need to click on an arrow to enlarge the area in which to type. Your questions will post on my screen, and I will answer the questions or address the comments during the question and answer period. You do not have to wait. You can type your questions and comments at any time. If you're viewing the recording of the webinar and you have questions or comments, please email me. So let's get started with the webinar for today, October 16th. And as I get started, I'm going to assume that you either attended or viewed the October 3rd webinar. If you have not, after this, of course, you're welcome to view the October 3rd webinar, which is posted on my website. All right, so today's topics, I have some more updates on Medicare supplement for 2021. I'm going to review Part D updates and then provide enrollment instructions and options. We'll follow that with the question and answer period. So during the last webinar, I discussed the new rates for Washington, D.C. residents for 2021. Now, that impacted United Healthcare members only in D.C. If you have a different company, it didn't impact you. Now I'm going to be talking about Maryland. So for AARP United Healthcare members, United Healthcare has announced the rate increase for 2021. If you have a plan in effect prior to 2020, and if you have Plan F in place, the rate increase will be 4.5%. If you are a Plan G member, the rate increase will be 4.4%. These rates, again, are effective January 1st, 2021. If you have a 2020 effective date, then women will have a 4.4% increase, men a 4.5% increase. However, if you have enrolled in a plan after January 1st of 2020, Maryland mandates a 12-month rate guarantee. So if, for example, you're new and moved on perhaps June 1st, you would not experience the rate increase until June 1st because of the 12-month rate guarantee. I want to point out again, as I did in last week's webinar, Medicare supplement plans do not participate with the annual election period. There is no annual enrollment period for Medicare supplement. If you would like to make a change, you may make that change at any time. So you're not bound by requesting or making a change during this hectic time of the year. You can do it at any time, but your health must allow you to make that change. When you're new to Medicare, or if you have a special circumstance, acceptance is guaranteed. But outside of that, if you wanted to make a change, you would need to disclose information about your health to the insurance company of your choice, and the insurance company will determine your eligibility. For United Healthcare members, to the best of my knowledge, nationwide, the extras are continuing for 2021. I went over this in detail in last week's webinar, but I just wanted to point out again today, if you are a United Healthcare member, the extras are continuing at no additional cost. It includes a gym membership program and a new dental discount program, as well as the vision and hearing discount program, all provided to you at no additional cost. All right, let's move on to the Part D updates. Some of this will be repetitive, but I think it's important to review it. Again, I have hundreds of people with what is now called Envision. Envision the prescription drug company is changing its name to Elixir. If I have done a review for you, or if you have done your own review, or if you choose to take no action, and if you live in Washington, D.C., Delaware, Maryland, New York, or South Carolina, no action is necessary. You will be automatically renewed into the current, what is now the Envision RX Plus plan, and changing to the Elixir RX Plus plan. However, if you live outside of those states and the district, and you want to keep what is now known as the Envision RX Plus plan, you must take action. It's a simple re-enrollment process. It's not a whole new application, but Elixir is contacting members with a form and with instructions to enroll online or a phone number to call. You must take action to keep the current plan. Otherwise, you will be automatically enrolled in the Elixir Secure plan. And based on the reviews that I've completed, if you have the RX Plus plan and you're happy, you probably would not be well served with the Secure plan. So you would need to take action regarding that. Magellan. I did not mention this in the prior webinar because I did not know. Magellan doesn't work with independent agents. And Magellan is terminating its plan. Now, it's not unusual that a plan would terminate, but what is unusual is there's no auto re-enrollment into another plan. Usually an insurance company would work out an arrangement with a different insurance company. It's called mapping. And in this case, Magellan members would be automatically enrolled in a different company's plan unless action were taken. Magellan is simply terminating. If you would like to keep a prescription drug plan, you must enroll in a new prescription drug plan. Otherwise, the Magellan plan will terminate December 31st, and you will not have a prescription drug plan. Any Magellan member should have received communication through the Postal Service from Magellan. Mutual of Omaha. I represent Mutual of Omaha for Medicare supplements. However, I do not represent Mutual of Omaha for its prescription drug plans. Don't read anything into that. It's very time consuming for me to be able to represent companies from a compliance standpoint, testing, and I've just chosen not to pursue Mutual of Omaha. But what I want to point out about the Mutual of Omaha plan is the value plan, which was very popular. The Mutual of Omaha value plan members are being automatically re-enrolled into the Plus plan. And my reviews to this point are indicating it's probably not in your best interest, if the value plan works well, for you to move to the Plus plan. So if you'd like a different plan, you must take action. If you take no action, you're going to be moved into a higher premium plan known as the Mutual of Omaha Value. Some good news for Humana Walmart Value Plan members. Now, in the past, as the name suggests, the Humana Walmart Value Plan, the preferred pharmacy was Walmart and Sam's Club as part of Walmart. Well, for this year, Humana has expanded the preferred pharmacy network from just Walmart and Sam's Club to include Publix, Kroger, Harris Teeter, and Costco. So any members with the Humana Walmart Value Plan, you're not locked into now using Walmart or the mail order to get the lowest costs. You could look at other pharmacies. All right, let's move to enrollment instructions. What's happening? All right, to back up, the Medicare website was loaded with 2021 information October 1st, and I've been working on reviews for the past 2 weeks. October 15th, yesterday, was the actual start of the annual election period. So now we are in the time frame in which, if it's appropriate for you to make a change, you may do so. And the annual election period will continue until December 7th. If you enroll in a prescription drug plan during this time frame, your effective date will be January 1st, and you will be automatically terminated from your existing plan. So if you choose a new plan, you don't have to contact the old plan. The termination is automatic. ClearSpring has been a really popular plan based on the first wave of reviews that I've completed. I wanted to point out to everyone that ClearSpring joins Cigna, Elixir, and Express Scripts as companies not working with agents. Now, prior to 2021, Elixir was Envision. Candidly, it was my number one company for prescription drug plans. I can no longer write new business for Elixir. And I'm just mentioning here, as I've mentioned in previous webinars, do you see a trend here? You've got some major players, insurance carriers for prescription drug plans choosing not to work with agents. The Medicare website has now been password protected for you to do your own drug plan review. Now, I can do a drug plan review without the password protection, but I can't save the work. So it seems to me Medicare is looking for you to do your own drug plan reviews, and insurance companies are turning its backs on agents. So again, just please look at the writing on the wall of what's happening with prescription drug plan reviews. I want to repeat, if you have an Envision plan, which I wrote, Envision is allowing me to continue to be the agent of record on prior business. I can no longer write for Envision. Now, if you'd like to enroll in one of these plans, if I've done a review for you or if you've done your own review, ClearSpring has been very popular. You will enroll directly. I will be contacting you with instructions, but you will be rolling in directly with the company. Same if you're a new client to Envision, Cigna, or Express Scripts. What does that mean? Don't read anything into this. I'm just letting people know so many times someone enrolls in a prescription drug plan and 2-3 days later I'm receiving an email or a phone call. When can I expect to receive my ID card? Or I can't remember which payment method I chose for my plan. If you're enrolling directly with one of these plans, I have no access to provide service. So you would need to contact the companies directly. I'm in no way trying to imply that you shouldn't enroll with these plans. If I've done a review for you and you can save money with ClearSpring, I encourage you to enroll after you check everything out. But I have to disclose to you, if there's an issue, you'll be dealing directly with ClearSpring. I cannot step in on your behalf. Now, the companies that I do represent: Humana, SilverScript, AARP, United Healthcare, and WellCare. If I've done a review for you and I've written to you and suggested that you make a change, I am able to handle that enrollment for you, and I will be in touch. This is the most hectic time of the season because I still have a tremendous number of review requests coming in to complete, which generates questions, and yet I still have to get the enrollment started. So from this point forward, I may be a little slower in responding. If you submitted a drug plan review request and you haven't heard back from me, it may take me a little while to get to you, but I will. I'm confident that every review that I've received to this point, I'll be able to respond to. As I mentioned in the previous webinar, I probably won't be able to get to all the reviews for the folks that aren't listening to these webinars and contact me later in the season. At some point, I'm going to have to cut it off so that I can catch up on the reviews that I have received. All right, I'm repeating again. If you're Elixir, I can continue to service the business if you're an existing member. If you're moving to Elixir as a new client, I may not. Now, if I've recommended a change for you or suggested a change, you would have received 3 reports: a comparison report, and then detailed reports for each company, the current company plan and the plan which you may move to apparently save money. Please review those reports, particularly my input of your medication. The input determines the output or the results. So if a mistake has been made, let me know. I'll do my best to rerun it for you. But don't just take my email as we're ready to go. You need to check the work. You need to make sure I've input everything correctly for you. The decision to change is yours. All right. Now, one thing to look for, if you're taking an expensive medication, a medication that's classified as tier 3 or higher, and if the report, the run, seems to indicate an extremely low amount for that premium, check it out. There could be something wrong. The Medicare website may have incorrect information. You need to check it out, all right, particularly for the tier 3 or higher medications. You can even call the insurance company to ask these questions, and the representatives will help you. The reports, the printouts that I'm forwarding are from the Medicare website. There's a plan finder tool. You have access to it. You have login access to it where your medications would load. I encourage you, please start to get comfortable with running your own reviews. As I mentioned earlier, it seems to me pretty clear that the government doesn't want agents to provide this service because of compliance issues, privacy issues, and now insurance companies seem to think agents aren't necessary. So please start to get familiar with the Medicare website and run your own reviews. I don't cross-reference the information with the individual companies. I only use the Medicare website. And as I mentioned earlier, every once in a while, the Medicare website is wrong. I'm dealing with one client with a unique medication, and one pharmacy has an extremely low price. And I've contacted the company to say, I think there's a coding error. I think there's a mistake. And I can't get anyone in that insurance company that even understands the question that I'm asking. So I have to disclose to my client, who actually found the error, not me. I explained to that client, I don't know what to do. We could try it. We can do screen prints to show. But if it's incorrect, I don't know whether the insurance company, if this man enrolls in the plan, will be bound by what's shown on the Medicare website. So again, just a heads up. All right, so that concludes my presentation. Please start to submit your questions. I'll do my best to answer. All right, I see one. We had an audio issue last week with several people, and one person has written again, can't get audio. Obviously, you can't hear me, but I'll write to that person to let that person know that a recording of this webinar will be posted on my website. I expected it to be posted this afternoon, but certainly no later than tomorrow morning. All right, I have a question here. Mutual of Omaha Value Plan to Plus, is that just for drugs or is that for everything? That's just for the drug plan. Yeah, everything today was all about the drug plan. So Mutual of Omaha currently has two plans, Mutual of Omaha Value and Mutual of Omaha Plus. And Mutual of Omaha is eliminating the value plan, and therefore anyone with the value plan is being switched to the Plus plan. Has nothing to do with Medicare supplement. And Susan, I'm glad to see that. So there was an audio issue, but it was resolved. All right. Can we still request that you do a comparison for us? Yes. Deborah, please view the webinar from October 3rd. Now, let me pause here for a second. A lot of people, I have to say, please go back and view this webinar. You don't have to view the entire webinar. Every webinar, I put the agenda on there so you can go right to the points that are important to you. But last week, I gave the instructions on how to request a review, and I did have a disclaimer. I don't know if I'm going to be, in fact, let me rephrase that. I will not be able to complete all requested reviews. So those of you that are on the line today, those of you that listened last week, I'm confident I'd be able to complete your reviews. What I am worried about are the people that do not read the emails, do not attend the webinars, do not view the recordings of the webinars, and in mid-November and early December contact me for a drug plan review, and I will have to politely decline to do it at that time. That's my expectation. There are other methods to obtain a review. It's just that with the volume I'm receiving, again, let me just show this. This is just for 2 weeks. All right. I will not be able to keep up with the volume. Whoa. Okay. The questions are coming in fast and furious now. Let me back up. All right. Where do we get a review request form? Mo, again, if you view the webinar, you have all the instructions. The form is available on my website. All right. Excuse me. How should I update my prescription information with you for Part D? Again, please view the prior webinar. I have the instructions on how to proceed. There is a form which is required. It's available on my kmdinsurance.com website. Can I set up a review with you? Same answer. If you would like a review, a form is required. The way that I operate, because of the volume, you send me the form. My wife, Liz, will acknowledge receipt of the form. I then complete the review using the Medicare website. The results are emailed. Now, if I infer from that you want to have a phone call, I don't do phone calls. I can't. I'm sorry. I know everyone wants to have the 20 or 30-minute conversation. I cannot accommodate that because of the volume. So I respectfully ask that everyone view the reports and email questions. If there's a problem or a unique situation, I will schedule a time for the call. Please remind us of the deadline for enrolling in a new drug plan. December 7th is the close of the annual election period. When we get charged more for a drug than is on the Medicare.gov website for the plan, how do we handle after the fact of paying the higher cost? Mark, please send me an email with more information. I want to make sure that there are different levels of coverage. So if there's a deductible on the plan, you may have to pay the full price until the deductible is met. Then there's a period of time known as the initial coverage period, where there would be a given, usually co-payment for a medication. Then there's a donut hole where the amount changes. And for folks taking expensive medications, there's also a coverage gap. So it depends. And I'd like the opportunity to check that out before answering for you. Could you talk about WellCare, please? If you did this before, I could hear. I didn't mention WellCare. For years, I did not represent WellCare. WellCare acquired Aetna's block of business for prescription drugs, and I had have a large number of people that had enrolled using Aetna. So for 2020, I actually became contracted with WellCare. So I do represent WellCare now. WellCare is continuing. WellCare has, I believe it's 6 plans, 3 of which are still the old Aetna plans with the Saver and the Select. And WellCare has its own plans, such as the Value Script Plan and the WellCare Wellness Plan. There are 2 others, the name escapes me right now. But everything's continuing with WellCare. And WellCare is working with agents. All right, I was able to get on this webinar until 9:15. I was trying before 9 a.m. Are you sending an email explaining what you started with what I missed? The webinar will be recorded and posted on my website. I'm hoping to have it posted this afternoon. So Lisa, you can just access my web page under the webinars tab and you'll be able to listen to the first 15 minutes. I'm newly enrolled in Medicare and have AARP and Envision programs. Do the new discounts for the extras on the members who are in the first 12 months rate also benefit from the new discounts, particularly benefit no action is taken? Okay, I believe the question here is, since someone enrolled during 2020 and is in the 12-month rate guarantee, will the discounts still apply, which are being offered by United Healthcare? Yes, absolutely. Now, the dental discount program doesn't begin until January 1st, but you'll automatically have access to that. You have access now to the iMed program and the hearing program and the gym membership program. I know a lot of gyms are closed, but United Healthcare has a gym membership program for you. So Lisa, yes, you're all set. Raymond, thank you. To be clear, when you refer to Envision, you meant Elixir, right? Clayton, yes. Yes, Envision is changing its name to Elixir. All right, I see there is a new Aetna plan for Part D. Do you have any info, good or bad, regarding this? I am not aware of a new Aetna plan. Aetna's prescription drug plans were acquired by WellCare, and then where it gets confusing is SilverScript was acquired by Aetna. But I'm not aware of any branded prescription drug plans with the Aetna name. All right, next one. How do I do comparison on Medicare site for prescriptions? You access the Plan Finder tool at medicare.gov. If you have a My Medicare username and password, you may log in and your prescriptions will pre-fill. If you do not have a username and password, you may create one. What is your website called, please? Oh, let me put it on the screen. Hold on one second. kmdinsurance.com. What do I need to do to get United Healthcare Dental and Vision? Is there an extra cost? Michael, if you are already a United Healthcare member, it's included. If you have a Medicare supplement carrier other than United Healthcare, well, of course, you'd have to make a switch, and that would depend upon your health for eligibility purposes. Okay, next one. We have a med, which is extremely lower at CVS, and they have been supplying it at an extremely low price. So it can happen. Also, if you want the lowest ongoing cost, you should look at price variations within the plan each time you order a drug. The difference can be significant. Gary, I agree. That's the importance of these drug plan reviews. Have I played Augusta? No, I have not played Augusta. And for my birthday this year, my wife had gotten me tickets to attend the 2020 Masters. And we all know what happened. But hopefully we'll be attending in 2022. All right. Okay, Mark. Thank you. All right. Next one. How can we find what vaccinations a Part D plan will cover? I've been waiting for several years for a coveted Shingrix vaccination and only recently was told by my doctor that it would be covered by my Part D plan. All right, Edward. Medicare Part B covers some prescriptions. You can go to the Medicare website. The flu shots, for example, are covered under Part B, B as in boy. There's a lot of confusion with the Shingrix vaccine, which is covered to the Part D. But starting last year, the vast majority of plans have a deductible. For 2021, the deductible is $445. For the remaining months of 2020, the deductible is $435. So if it's the first medication, Shingrix, that you are taking during a year, that's going to be a tier 3 or higher medication and therefore subject to the deductible. So the plans, the vast majority of plans cover Shingrix, but you may have to pay fully out of pocket for the Shingrix because of the deductible. I hope I didn't confuse you with that one. All right, Mark is writing again, but we're not in the gap, didn't even meet the deductible. All right, well, I would need to know the medication, Mark, so if you send me an email. Do you know why Mutual of Omaha quadrupled their price for 2021? Yes, it was what I explained earlier. You probably are enrolled with the value plan. The value plan is being eliminated, and everyone with the value plan is moving to the plus plan. The plus plan is an extremely higher cost plan. You'd probably be better served with the premier plan if you stay within Mutual of Omaha. All right, this is great, a lot of questions. So next one. Elixir sent me an email, quote, if you do not take action between October 15th and December 7th, you'll be automatically enrolled in our plan with a higher premium. To evaluate your options and find a plan which is right for you, contact your insurance broker. There is no link or form for me to request Elixir on my own. Okay? This is what I addressed earlier. You must live outside of D.C., Delaware, New York, South Carolina. Oh, it's 9:30 already. My wife is telling me it's 9:30. Let me pause here for a second. If you've had enough, please feel free to terminate the call. I have about 5 more questions which I will answer. So thank you very much if you decide to bail out at this point. Anyone who's waiting to have an answer question, I'm going to stay on for another 5 minutes or so. So, Steve, you must live outside that area. That was the bullet point that I had earlier about right here. Right? So if you live outside and you want to keep what is now being called the Elixir RX Plus plan, you must take action. There's a re-enrollment process. It's not a full application. You should be receiving something through the mail. Now, Elixir is no longer working with agents. They're supposed to send to me the information. As of yesterday, I haven't received any information about re-enrolling. You're welcome to forward me the review request form. I'll let you know if I believe it's in your best interest to stay with Elixir. I doubt the Elixir Secure will be in your best interest. What is the procedure for obtaining UHC discounts? Is there a form that needs to be filed when we receive a bill from a dentist? Candidly, I don't know, Patrick. I mentioned this in the previous webinar. It's brand new and hasn't started yet. It's going to start January 1st. So you're welcome to email me, and I will send you the document that I had on the screen. Oh, I love this, Toby. Is that Jackson Brown in the background? Yes, it is. Hold out. No one noticed Springsteen last week, so thank you, Toby. Please talk about GoodRx. GoodRx is an opportunity to shop your plan. You can go to goodrx.com. Last year, Lisa, if you send me an email, I'll send you the information on a webinar I held last year. I think I also did it in February this year about saving money through GoodRx. Michael, you currently have United. Well, if you're currently with United Healthcare, then those discounts are included for you at no additional cost. Ross has left, but he was thanking me, so thank you. Pamela has left, and she has thanked me. Thank you. Thanks for doing this. You're welcome. Didn't get a notice about last week's webinar, but I will contact you. Remember now, if something goes wrong with email, if you miss something, if I've gone too fast over something, all the webinars are recorded and posted on my website. All right, last question. We have Mutual of Omaha. We have Mutual of Plan G, but can't tell it's the one that's tripling. No, the Medicare supplement is not part of the tripling. That's the value to plus prescription drug plan. So, all right, people thanking me, thank you. So your classes look like those at Costco. Yes, Costco. My wife bought me about 15 of these. All right, we're all set. I'm going to end it here. So if you have any other questions, or if I missed your question, just please email me. Thank you very much. Let's get through this annual election period. Thank you.